Hello everyone, welcome to Radiology Case Review Series. In this video, we are going to look at images of an elderly male patient who presented to emergency department with right-sided flank pain. Clinical team was concerned about nephrolithiasis with obstructing stone. Patient was referred for CT examination using flank pain protocol. Let's look at the images. So on the flank pain non-contrast CT examination, as I scroll down, we can see bilateral renal cystic lesions, some of which are indeterminate. Also, as I scroll down, we don't see any obstructing stone in the right kidney, which was patient's symptomatic side. However, we do see quite a bit of inflammatory fat stranding surrounding the right kidney, and as I window, we can see subcapsular hematoma surrounding the right kidney. As far as we know, patient did not had any trauma. He was also not on any anticoagulation or blood thinners. So it looks like patient has developed spontaneous right-sided subcapsular hematoma with extensive surrounding inflammatory fat stranding, which would explain patient's right-sided flank pain. So appearances are consistent with spontaneous subcapsular hematoma, which is also known by the eponym Wunderlich syndrome. This is an excellent review article written by my colleagues. As summarized in this article, Wunderlich syndrome refers to spontaneous renal or perirenal hemorrhage happening in the absence of trauma. This is less common cause of renal perirenal hemorrhage compared to iatrogenic or traumatic conditions. Classically, patients can have triad of symptoms described by Lenz triad with acute onset of flank pain, flank mass, and hypovolemic shock, which is seen in less than quarter of the patients. Most of the patients present with isolated flank pain, as we saw in our patient. And when they undergo emergency imaging using unenhanced CT due to concern for nephrolithiasis, this can be incidentally detected. In terms of etiology, it is usually attributed to neoplasms, vascular disease, cystic renal disease, or anticoagulation. Our patient was not on any blood thinners. During the follow-up, no underlying mass lesion was seen. It is likely that given the multiple renal cysts, one of the cysts ruptured and caused the spontaneous subcapsular hematoma. I hope you found this case of spontaneous subcapsular hematoma, Wunderlich syndrome, to be interesting and informative. Thanks for your attention.